Good morning. We'll go ahead and get started. Last week, Iowa achieved yet another vaccine milestone after administering 2 million doses just 5 weeks after hitting the 1 million mark. To date, more than 53% of Iowans age 18 and up have had at least one dose of vaccine, and more than 37% have now been fully vaccinated, ranking Iowa 15th in the country. As of April 8th, more than 50,000 vaccine doses were administered to Iowans, and that's the highest number in a single day since vaccination began. But news early last week of the FDA's and CDC's decision to pause use of the Johnson & Johnson vaccine due to an extremely rare blood clotting disorder that occurred only in 6 individuals out of more than 7 million who received it has some Iowans reconsidering whether to get vaccinated. Unfortunately, Iowa and states across the nation are seeing a decline in uptake of vaccines since the J&J announcement. As a result, this week 43 counties have declined some or all of their vaccine allocation for next week so that supply doesn't exceed the current demand. While it's disappointing to see the shift, choosing to accept only the amount of vaccine that can be used is absolutely the right and responsible thing to do. Vaccine supply that's been declined is being reallocated to more populous counties and metro areas where demand is still higher. But even in larger communities, clinics are now filling up over the course of a couple days rather than just a few hours. Some pharmacies are seeing appointments remain still open. So this shift isn't, again, unique to Iowa. Vaccine hesitancy is beginning to become a real factor across the country. A study published earlier this month by the Kaiser Family Foundation takes a closer look at vaccine uptake and the intention among specific demographic groups. When it comes to age, young and middle-aged adults are least willing to be vaccinated. 50% of adults age 18 to 39 said they'd wait and see before being vaccinated, and that's compared to 28% among adults 40 to 59. For those who definitely did not plan to get vaccinated, 45% were 18 to 39 years old, and 36% were 40 to 59 years old. So these results, I think, likely reflect a sense of security among younger adults who typically experience only mild illness from the virus and are generally less concerned about preventative care. Whatever the reasons, it's important to understand why certain groups may be hesitant so that we can continue to do everything that we can to take a more targeted approach to providing the information and vaccination options that are most relevant for them. It's one of the reasons that we have decided to intently focus on vaccinating college students before they return home. 2 weeks ago, Iowa's record-high vaccine allocation helped jumpstart clinics for students in Iowa's colleges and universities. The Johnson & Johnson vaccine was distributed to Iowa's 3 regent universities for student clinics, and many private colleges, universities, and community colleges are working with their local public health departments or area pharmacies to administer vaccine to their students. The pause on Johnson & Johnson put a temporary hold on college clinics, but thanks to the quick work of the Iowa Department of Public Health and the local public health teams, additional doses of Pfizer and Moderna, were provided, and within just a day or two, college clinics were reopened and students are again taking advantage of the opportunity to get vaccinated. Today, I'm pleased to welcome Erin Baldwin. She's Associate Vice President of Student Health and Wellness and the Director of Thielen Student Health Center at Iowa State University. And she's going to discuss their plans to continue student vaccinations and why it is so important to get that done. So, Erin, thank you for joining us.
Thank you so much, Governor Reynolds, for having me this morning. Iowa State University is thrilled to be offering large-scale vaccine clinics on campus, and we really appreciate the prioritization that's been given to colleges and universities across the state as we work to provide vaccine to as many of our students as possible before they leave campus this spring. Iowa State's vaccine journey began at the Thielen Student Health Center in December of 2020, and the Health Center and emergency management teams have worked closely with the Iowa Department of Public Health and Story County Public Health, and we're really proud to support vaccine efforts for Phase 1A and 1B And it's even more exciting now that all adults are eligible to be vaccinated and we can be doing these campus clinics. Obviously, there are a lot of details and logistics to consider when planning for large-scale campus clinics, everything from finding the right location, IT needs, how we're going to staff the clinics, how this clinic functions from registration to administering the vaccine, and to observation after receiving the shot. There are certainly lots of moving pieces, and all the planning and detail is important to make sure everything runs smoothly and efficiently. To share a little bit of how our clinic works, patients can schedule an appointment online, and once they arrive for their appointment, they check in and register, they get their vaccine, and then they complete the 15-minute observation. Our goal is to make this as convenient as possible for our students and all of our patients and have them on their way in about 20 minutes total. We're handing out buttons and stickers, and patients can even get their photo taken with Cy before they leave the clinic. Our clinics are set up to have the capacity to administer several thousand doses per week, and we plan to provide weekly updates on our ISU COVID-19 website. Our campus clinics would not be possible without the support of hundreds of volunteers who have stepped up to help. Our vaccinator roles are being staffed by our Thielen Student Health Center clinical team, and we're also so grateful to have the support of a group of our College of Veterinary Medicine veterinarians and fourth-year veterinary students. Additionally, we've had support from our ISU Occupational Medicine, Story County Public Health, and Mary Greeley Medical Center. These campus and community partners have been so instrumental for us over the past 15 months and have truly shown the Cyclones Care spirit. For me, the best part of our vaccine clinics is seeing the joy of our students and employees. I've had the opportunity to talk to many people who are so excited to know that they're protecting themselves, their loved ones, and our campus community. Many have shared stories about finally planning to see loved ones, being able to participate in campus events, and these vaccines are fundamental to achieving these goals. We really want to encourage not only our campus community to get vaccinated, but all adults. We know that vaccination efforts are going to support our efforts to return to a more traditional Iowa State University campus experience. And we really want our students to have the opportunity to be in the classroom, participate in student organizations, attend athletic events, spend time with their friends, and find their community of people that makes Iowa State such a special place. And getting a COVID-19 vaccine helps us achieve all of these goals. Thank you.
Oh, thanks, Erin. I appreciate that so much. And I just love all the coordination and collaboration and the volunteering that's taking place to make this happen. And you certainly hit on that. So please thank the entire team for their efforts to get as many students vaccinated as possible before the end of the spring semester. And just one more shout out to the parents of college-age students. Please help by encouraging your sons and daughters to get vaccinated while they're still on campus. And you hit on it. It's protecting their loved ones by them doing that. So together we can all do our part to make sure that things return to normal in the fall, and vaccination is how we're going to help make that happen. So thanks again, and I look forward to hearing how everything went. So we'll touch base later, or the first of next week. So thank you, Erin. I appreciate it. Last week, the Iowa Department of Public Health announced Iowa's first positive COVID-19 case caused by the P1 or Brazilian variant. And the CDC reported that the B11V variant, more commonly known as the UK variant, is now the most common strain of the virus that's circulating in the United States. The emergence of the new COVID-19 variants is to be expected, and it's normal with any type of virus. The flu virus is constantly changing, which is why we're vaccinated for it annually to protect ourselves from the next strain that research suggests may be the most common during the upcoming flu season. So recent news that COVID-19 vaccine booster may be needed within a year of initial vaccination, and perhaps every year, isn't surprising. It's just how we continue to deal with these types of infectious diseases. At some point, it might be possible to be vaccinated for COVID-19 and flu with just one shot that protects against both of the viruses, like the all-in-one MMR vaccine that protects against measles, mumps, and rubella. For now, the good news is that the studies also show that all currently available vaccines are effective at protecting against variants of the virus, and available data suggests that the positive effects of the vaccines may also be long-lasting. Early studies of both Pfizer and Moderna since vaccination began indicate that antibody levels still remain high 6 months after being vaccinated. And while there isn't enough data yet for the Johnson & Johnson vaccine because it hasn't been available for as long, results from its clinical trials suggest that it will perform in the same range as the other vaccines have performed. And this is, of course, great and welcome news, and it reinforces the efficacy of all vaccines that are currently available. I think it is important to understand, though, as we're talking about vaccines, that no vaccine is 100% effective. Even with vaccines that have extremely high efficacy rates, it's possible that a small percentage of the population could still become affected or infected with the virus. Breakthrough infections can occur if an individual's immune system doesn't develop a strong enough protective response from the vaccine. But even a lower antibody rate can still provide protection from serious illness if an individual becomes infected. As the percentage of Iowans who are fully vaccinated continues to increase, so does the possibility of breakthrough infections. And we're now beginning to see a very limited number of these cases occurring in Iowa. Again, this is normal and expected. It's not cause for alarm, and it shouldn't be reason not to assume that the vaccines don't work or be used as an excuse to delay or avoid vaccination. At any level of protection from the vaccine can make a difference. You know, over the weekend, I received a message from someone sharing their personal experience of becoming infected after being fully vaccinated. He since then was, after being fully vaccinated, he was diagnosed with COVID-19 and he was admitted to the hospital, and when he asked his lung doctor why that happened after getting vaccinated, the doctor simply said that getting vaccinated when he did was the reason that he was probably still alive. If he hadn't been vaccinated, his story may have ended up much differently. So again, good reasons to go ahead and get the vaccine. Vaccination remains the best defense against the virus, and it's how we will downgrade COVID-19 from pandemic status to effectively dealing with it as we do the flu without disrupting our lives, livelihoods, or sense of normalcy, which is why vaccine efforts in Iowa must continue to keep pace. For weeks, we've encouraged Iowans to get vaccinated as soon as they're able, and I want to thank the 900,000 Iowans who are now fully vaccinated. We are making great progress, but we can always do better, and in this case, we absolutely should. Today, I want to appeal to everyone who's hesitating. If you're opting to wait and see, what are you waiting for? If you've been a hard no from the start, what's your reason? And if you can't answer those questions, maybe we hope that you take the time to reconsider. But don't take it from me, take it from someone who's been there, someone who knows just how serious COVID-19 can be and how simple the solution is to prevent it. I'm pleased to be joined today by the Iowa National Guard Adjutant General Benjamin Correll to share his personal COVID-19 experience. General?
Thank you, Governor Reynolds. Good morning, everyone. It's been a while since the governor's asked me to personally attend one of her press conferences. Generally, in the past, when I've stood at this podium, I report on the work that the Iowa National Guard is doing to support our citizens in the fight against COVID-19. Although the Iowa National Guard has and continues to work on mitigating this virus, today I want to speak to you from a different perspective, my personal experience. I've always been a healthy individual. I hadn't missed a day of work because I was sick. I had not been a patient in a hospital since the day I was born. My job requires me to be mentally tough, physically fit, and maintain a healthy lifestyle. I've served in multiple combat deployments and have been fortunate enough to have made it home safely. Last November, I woke up one morning and I didn't feel well. Over the course of several days, I had the entire laundry list of COVID-19 signs and symptoms. I could hardly get out of bed. My wife took me to get tested, and after a couple days, I got the phone call that says, "You're positive with COVID-19. I had been careful. I had done the things that the Iowa Department of Public Health and the CDC advised us to do, but I still got the virus. I was really sick, and I was not getting any better. I was in denial that I was as sick as what I was. 2 days later, my wife had me contact my family doctor for a telehealth visit because I was still getting worse. He told my wife to go and get a pulse oximetry meter and monitor the amount of oxygen I was breathing in. She went and purchased one that day. The next day, my oxygen levels were so low, she gave me the choice, either get in the car and go to the emergency room or I'm calling the ambulance. I got in the car and she took me to the emergency room. They quickly admitted me to the hospital where I stayed for a full week, receiving medical treatment from the medical staff at Unity Point Health, validating to me that our medical professionals have truly been our frontline heroes in this fight. The after effects of my experience with this virus still exist 5 months later. I understand that COVID-19 affects people differently. In my case, it was very real, very serious, and nothing to mess with. COVID-19 has killed almost 5,900 Iowans, and thousands more have been infected. This past year, we had no real defense against this virus. Everything that we were doing was reactionary in our attempts to keep this virus from spreading. You've all heard it before: PPE, wash your hands, disinfect areas, and socially distance. These were the only tools that we had available. Almost every day now we see the news that COVID-19 is still a reality. People continue to get sick, some are hospitalized, and others lose their life. We learn of new variants of this virus, and we still see spikes of new infection happening because of it in some places. Recently, we gained a tool to help stop this virus from perpetuating. We now have vaccines. We now have renewed hope. Hope to move forward without this plague following us and bringing more sickness and death. I completed my second dose of the Moderna vaccine in March, and I'm fully vaccinated. I had no hesitation in becoming vaccinated. I did it for my family. I did it for my friends, my coworkers, and for my community. It's going to take all of us working together to defeat this pandemic. I believe getting vaccinated is doing my part in helping stop the cycle of spreading this virus. As the vaccines were being created and now that they've been authorized for emergency use, the demand for vaccines has been greater than the supply. Today, we're at a tipping point where the supply could soon exceed the demand. For all of you that have been vaccinated, thank you for being a part of the solution to defeat this plague. For those of you who have not yet been vaccinated, I implore you to take the time to get it scheduled and get yourself vaccinated. For those of you sitting on the fence, wondering about getting vaccinated, do it. It's the right thing to do for you, your family, your neighbors, and our communities. Join us in being part of the solution to end this. For the one half of the current Iowa National Guard members who have not been vaccinated, for other Iowans who have worn the uniform and have previously served our nation who have not yet been vaccinated, I call on each of you now to serve your communities in a different way. Schedule an appointment to be vaccinated. Roll up your sleeve to be a part of the solution that will lead us out of this pandemic. Governor Reynolds, I thank you for your leadership. I thank you for allowing me this time at the podium today.
Thank you, General. I appreciate that very much. And I remember getting the news that you'd been hospitalized and feeling a sense of shock. If you can get the virus and become seriously ill, it can happen to any of us. And the fact that you chose the vaccine for your defense against it, I think, sends a really strong message. One, I hope, that will resonate with Iowans who are still deciding what the best course of action is for them. Every Iowan is now eligible to get vaccinated. And to make that process of getting an appointment even easier, all Iowans can now call 211 for assistance with scheduling an appointment at a vaccine provider near them. The call center is ready to help anyone for any reason. Vaccine navigators are available daily from 8 until 5 p.m. And so they stand ready to help you get that appointment scheduled. Finally, if you're in the Sioux City area on Friday, we invite you to get vaccinated with the Lieutenant Governor, Adam Gregg. and a few other surprise celebrity guests. It will be at the Siouxland Expo Center. It'll be from 12 till 2 p.m. And I want to take this opportunity to thank the Siouxland Chamber and Hy-Vee for hosting the clinic. You can schedule an appointment for the clinic through Hy-Vee's COVID vaccine website. You just need to select the Lieutenant Governor Adam Gregg Vaccination Clinic from the events menu. And Lieutenant Governor Gregg, I think, looks forward to seeing you there. So with that, we'll open it up for questions.
Governor, a Minneapolis jury yesterday found ex-police officer guilty of murdering George Floyd. Do you have comments on this major verdict?
Yeah, well, I think, it shows that our legal system worked and that justice is being served. The jury, a jury of his peers, found him guilty on all 3 charges. And so I think the system worked, due process, and it's time that we all come together as a country, heal, and continue to move forward.
Governor, related to that, the legislature is poised to pass a bill that would increase protections for police and higher penalties for protest-related crimes without including the ban on racial profiling that you had proposed. What message does that send, especially in light of that verdict?
Well, it's all working its way through the legislative process. That's how legislation works. We're going to continue to advocate for those important issues that I put forward in my policy. I'm proud again that we were able to pass the More Perfect Union bill last year. We did that by both parties coming together. It was unanimous. It was really instilled sensible policy reforms. It addressed training and accountability. So we made really good steps from that. It was supported both by law enforcement and civil rights organizations. So I think that's an example of how we can come together to really address both aspects of it, and that was my intent with the legislation that I put forward this year. So we'll continue to work on it. We're still in session. We're still working through the process, and we'll see where it goes.
Governor, the legislature passed a bill that would ban voluntary diversity plans. Do you have any comment on that? I know you're a proponent of open enrollment expansion in Iowa.
Yeah. I agree with the bill. That was part of my Students First Act that I put forward, especially after hearing some of the stories I heard from kids and from parents. I think competition is a good thing. I think it's imperative that we have a strong public school system. I have a daughter that's a public school teacher. I've demonstrated that by the investments that we've put into public education. But I also think it's unconscionable that when parents feel that because of things that are happening within the school district that they want their child to have a different option, that they should have that option and they shouldn't be denied because they don't have the financial means to make that happen. And I would say, some of the concerns that was raised in opposition to the bill is actually already happening, and this levels the playing field. I believe that's what should take place. I believe it's the right direction to move forward, and we're going to continue to do everything we can to make sure that we're enhancing and lifting up all modes of education for our children, and that's how we do better. That's how our parents have more choice in the process, and I think COVID-19 has certainly demonstrated how important it is that parents have some choice in their children's education. And we continue to see that play out horrifically in some of the other states in this country. Kids are still not in the classroom at this point. And so all of that comes together. It was a comprehensive bill that addressed it from all levels. And I think that's the right direction to move forward. I'm proud that the majority of our kids have been in the classroom since August and receiving the education that they deserve, and we're going to continue to work hard to make sure that we have that equity in education.
Governor, in March you proposed getting rid of what are called triggers.
Yep.
In other words, speeding up a series of income tax cuts for
Yep.
Iowans.
Yep.
Is that the only tax cut that you would accept? If not, what others do you plan to accept?
Okay,
from the
I'm always
legislature?
interested in looking for opportunities to reduce taxes on hardworking Iowans and to really be more competitive as a state. I talk to my colleagues around the country all the time, and every single state that I have had the opportunity to visit with, every single governor, are looking for opportunities to reduce the tax burdens and to be more competitive as a state for business and industry, but most importantly for hardworking Iowans. So by removing the triggers, it guarantees Iowans that that tax cut, that historic tax cut that we passed in 2018, actually will go into effect. I think we're probably going to meet it anyway with the projections that we're looking at, but it ensures that they will see those tax cuts. It goes a long way from reducing the brackets and making us more competitive. And but we're going to continue to look for other ways in addition to continue that reduction and continue to make the state more competitive. So I'm always open to looking at different options when it comes to that.
So would you accept cutting or eliminating the inheritance tax? Would you accept no longer taxing the, at the state level, the PPP loans that businesses have received?
So I have to take a look at all of that and make sure that it's, number one, it's the right thing to do. We're being really strategic in how we're doing it, and that we make sure that we can sustain it. I've said that from the very beginning, even when I signed the legislation in 2018. We want to make sure that it's sustainable, and we want to make sure that we can continue to fund the priorities that are important to Iowans. So that's those same applications and those same metrics still apply as we continue to move forward and look at different ways that we can reduce the tax burden on Iowans. So those are all things that we will take a look at and see how that fits in the larger narrative of providing permanent tax relief for Iowans moving forward. So we're reviewing all of that. Those are in bills that are bouncing back and forth, and we're still an open round, so we're liable to continue to see different proposals be put forward, and I want to remain open in looking at all of them. Yeah.
I have a question about the hesitancy issue that you've discussed today.
Yep.
And in our own polls at the AP with our polling partner and others have shown that there is a dynamic that has to do with Republican conservatives resisting it because I think it's their issue with government overreach and perhaps their belief that maybe science isn't always accurate. So that's a difficult nut to crack, it seems like. How do you get to those people who just have a philosophical, perhaps political opposition to the vaccine?
Well, I've laid out some of the dynamics, and the age bracket is where we're seeing the largest hesitancy. And that's your poll, but I think we need to look larger scale, and we need to really do a deep dive and take a look at why, what's behind it, what can we do to help ensure Iowans that they are safe and this is the right thing to do, especially as we work to open back up and just continue to get life back to normal. And we're doing that. That's why, I talked about this last week. I've talked about it for several weeks, actually. It really goes back to people that they feel comfortable with, people that they respect, community leaders, really bringing them into the fold. We've done that through our religious communities. We're working with United Way. We're working with Embark. I'm sending the lieutenant governor up to get, a vaccine. He fits that dynamic that we're talking about that might be not just because of the party dynamic. He fits the age dynamic that it has shown, the Kaiser Family Foundation, so they've done I think probably a large review, and that was the area that, one of the areas of the age brackets that they said was most hesitant. So let's get in there and talk to them and see how we can address their concerns and hopefully move them forward. But we're working with just a whole host of people. We're doing micro clinics instead of large. We're still working with businesses. We're still doing a lot of outreach. Kelly and her team have done a great job working with Extension and with the University of Iowa in really targeting the messaging that we believe will help alleviate some of those concerns. But most importantly, I think it is about finding the individual that they feel comfortable with. I can stand up here and say it all day long, but if they know somebody that they really, feel comfortable with, and they do it, that might help move them to get there. So we're going to keep working, David, at every angle that we can to move it.
And the scientific advice is that if you've already had COVID, that's not a reason not to get vaccinated. I mean, the General Story is an example of someone.
That's why he's here today.
Right. So, because I've heard that personally too, is people who think, well, I've had it, so I'm immune, so I don't need to get the vaccine.
And that's never been said.
And I guess I wanted to just bring that up as an issue.
That's not a reason not to get a vaccine. And the individual that called me, he's a friend of mine, or not a friend of mine. The story that I shared, it was just the reverse. He had the shots and then got COVID. But because he had the vaccine, he's probably with us today. So it works both ways. Not only if you've had COVID, you should still get the vaccine, but if you've had vaccine, you tend and potentially might be a breakthrough case, you're still in a much better position to get through it.
Governor, I think you said 37% now for folks that are fully vaccinated, if I remember your numbers
Yep.
right, for 18 plus.
Yep.
What is your administration's goal to hit on this so that you feel we get, because the herd immunity thing seems
Yeah.
to vary based on the source. So
Yeah.
what are you shooting for the protection level
So we
you think
actually
is
had that
necessary?
conversation this week. So we're starting to kind of take a look at the data, and we'll start to maybe formulate that and take a look at what that looks like, Dave, because people that have had the vaccine, herd immunity, those have been vaccinated, we could maybe compare it to where we're at with what are the typical percentages for getting the flu vaccine, which Iowa is typically higher than the rest of the country. I think that's 40%. Kelly, is that correct? Pardon? Upper 40s for Iowans that get the flu vaccine. So that's kind of a good benchmark that we could kind of use to take a look at, but we're already exceeding that. So hopefully, you know, as we sit down and start looking at the data and and we'll kind of get some sense of what that looks like moving forward. At this point, we haven't done it.
Yeah, I just had a follow-up question for the general, actually. What are you hearing from the half of National Guard members that don't want to take the vaccine? And also, why not mandate it as a term of service?
Well, currently, it's not a mandatory immunization to take for the members of the military. Whether that changes down the road or not, I can't tell you today. I would say, you know, the members of the Iowa National Guard, we go out and recruit young, healthy people. And the preponderancy of our organization is young, healthy people that fall into the same categories that we just talked about. And that's part of the reason that I'm here. I think it's important for those members of the Iowa National Guard, the members of their family, for themselves and for the communities. And that's how we start to work to get to this herd immunity goals that we're all talking about.
Are you a long hauler? So are you still having COVID symptoms?
I have some shortness of breath. I have some lung capacity issues. I continue to work on those. Still have, I get up, go to work in the morning, but I still do feel tired at times as well. So I would say, yes, I fall into that category. But I fight it every day. Thank you.